Good morning. My name is Professor Tom Cherian. I'm a liver transplant surgeon and I head South Asian Liver Institute. Somebody asked me, what is unique about South Asian Liver Institute? Well, actually, I don't think there is anything truly unique in this world anymore. But I do believe that there are a few things that we do a little bit differently. Our printed and declared motto says it all. Our aim is compassionate service rather than commercial success. Our multidisciplinary team with dedicated attention to a liver disease patient provides unparalleled personalized patient care. That, I think, guarantees a higher level of service. Another thing that we pay attention to is a comprehensive and lifelong follow-up protocol. So once we have done an operation in a patient, we would want to see him or her every 3 months or every 6 months at least, and maybe 3 or 4 years later, once a year at least. The other advantage of being a dedicated liver institute is that we do not have to follow all the innovations in the world. We only need to follow the liver innovations. What is new in the world of liver surgery or liver medicine? So that allows us to be up to date with the treatment of our patients in our specialist fields. Another thing that we set up is outreach centers across the country. We have more than 10 to 12 outreach centers where people from my team visit those centers so that patients in those parts of the country can come to a center that is close to them rather than traveling 1,000 miles to come and see us. For example, yesterday I operated on a patient from Agartala. So in 3 months, for the follow-up scans and follow-up treatment, he has to come nearly 4 flights, 1,500 kilometers to just have a 20-minute consultation, which I think is quite tedious. The other thing is we are a liver transplant and hepatobiliary unit. And the fact that we have experience of over 600 liver transplants means that we are well used to certain techniques of vessel anastomosis, joining the vessel somewhere, so that if there is a cancer affecting a blood vessel, very easily we can chop it off and put a join in the blood vessel, so that something that other people would consider inoperable becomes operable. The other thing is that we have a very complete or thorough system of evaluation that is so complete that very rarely do we have to do what is known as an open and close, which is where you open a patient's abdomen and you close without being able to take out the tumor or the cancer. In our series, it would be less than 2 or 3%. This is very important because I think for a patient to have an operation and then find out that his cancer has not been removed can be very debilitating or demotivating. Finally, the patient is seen by an entire team in our institute, starting from me to some of the other consultant surgeons, to the anesthetist, to even the physiotherapist and the nutritionist. What that means is each of them give them specialist advice, show them what needs to be done in their fields, what is good from a nutrition point of view, what is good from an anesthetic point of view. This ensures minimal errors first of all and best medical therapy. I mean, what are the other things that is special about South Asian? I think it's a very small business unit which is controlled by clinicians. Therefore, we do not have targets, financial targets. We do not maintain large buildings or have big investors looking for a profit. Therefore, we are able to make small decisions for patients that only look at patient benefit and nothing else. There are other decisions that are made in South Asian that might not make financial sense. For example, our post-operative care is very stringent. We do more blood tests. We do more ultrasounds after the operation just to make sure that if there is a complication, we detect it early. This costs us more money, but it allows us to have better outcomes, more success. We have in South Asian until now in the last 2 years done about 50 to 60 liver resections, complex liver resections. We have not, by God's grace, lost even a single patient because of attention to detail such as this. We also have a tight control on our medications. We only use medications from reputed company, not necessarily the cheapest company. In last, but definitely not least, is that we have an international standard of nursing, of physiotherapy. There is one-to-one nursing. One nurse is not looking after 7 patients. Our patients are so complex, I think, that one nurse only looks after 1 patient usually. And if they're on the ward, maybe 2 or 3 patients, but not more than that. And they look after them very, very carefully, paying attention to minute details, so that all of these points put together increases our success rate, and although you might argue that it increases our cost, therefore decreases our profit. But as a small unit controlled by clinicians, these are decisions that we can make. So I think these are the things that I find are slightly different in South Asian compared to another corporate hospital.